Hi, everyone. Today I have with me Dr. Talia Marchegiani, a naturopathic doctor with a focus on mental health and hormones. Hi, Talia. Thanks for being here.
Hi, Anne. Thanks for having me.
Let's start with you telling us a little bit about yourself, the work that you do, and how you came to do the work that you do. So basically, tell us everything.
All right. Yeah, we'll keep the story short, but basically, I've always been interested in psychology and in mental health, and as a window to our general health and well-being. So it's sort of like, what's one of life's greatest values? You can't participate in life if you don't feel physically well, and then it's very difficult to feel physically well if you don't feel mentally well. So it was really interesting to me to focus on mental and emotional wellness as one of the key pillars of health. And I also felt that our skills as a naturopathic doctor fit really well into understanding our mental and emotional wellness. Because we have conventional solutions, but they leave a lot of gaps in treatment, and so not everybody responds well to the common treatments and medication and therapy, and there's a lot left uncovered in terms of how our hormones are working, inflammation, gut microbiome, oxidative stress, and brain function and nutrition. So there's so many things that could really impact our health in a positive way that so many people don't know about. And it leaves, so I felt like naturopathic medicine was a key pillar in a comprehensive care plan for somebody who not even is suffering from a mental health diagnosis or mental health condition, but someone who just wants to optimize their mood and their hormonal health.
Mm-hmm.
Yeah. And I became a naturopath. All right, what's the short story of this? Um, I studied pre-med at Queen's, and my goal was to be a medical doctor. And just through that journey with my own health, just contemplating sort of what was important to me and the kind of medicine I wanted to practice, I was interested in sort of grassroots type medicine. So doing the detective work and really getting to know a patient, putting dots together, and really understanding what lay below the surface versus putting someone into a diagnostic category. And I had my own experience with the medical system and feeling like I was left out because I didn't have a diagnosis, and all of my lab work came back, all of my blood work came back in the normal ranges, but I still didn't feel well. And I feel like so many of my patients are in those in between places where they're not getting the medical attention they need. They're not accessing the solutions that they might need. And they're sort of told that they're fine. Or maybe they're getting a mental health diagnosis without a real solution that's impacting how they feel. And so much is left out. And so I felt like I wanted to practice a kind of medicine where we would take a deep dive into what was going on, really get to know each other, spend a lot of time in the visit, and be able to access all of the factors that influence our health. So, getting deep into diet, getting deep into mindset, getting deep into our lifestyle practices or routines, how we live, psychological health, and use all the different tools that we have at our disposal, and be able to use things that are up and coming in the current evidence, and be able to play in that space rather than wait the 20 years for something to become established in the medical literature. I feel like we can implement things like nutrition and certain nutritional supplements and herbal medicine before it becomes sort of common practice in medicine.
Mm-hmm.
Yeah.
Yeah. And yeah, you touched a little bit on the medications, and we know, like in Canada, for example, between the ages of 18 and 45, the two most prescribed medications are antidepressants and oral contraceptive pills. And I know you're not anti-medication, and I'm definitely not anti-medication either, but they're oftentimes used as first-line therapies when, as you mentioned, there's so many different factors that come into play when we're looking at mental health. So can you speak a little bit to the different factors that impact our mental health in a little bit more detail? Like what role does the gut microbiome play? What role does our food choices and our lifestyle play?
Mm-hmm. Right. So, what we've done is narrowed down the diagnostic category of something like depression or anxiety. And so the narrative, which is actually more of a metaphor, goes along the lines of there's a chemical imbalance in your brain, so specifically a deficiency in serotonin. But then, you know, there are other neurotransmitters that medications act upon, like norepinephrine and dopamine, but more commonly it's serotonin, which is a chemical in our brain that produces feelings of pleasure, contentment, satisfaction, is associated with positive mood states. But it's only one part of the picture. And so this narrative goes that you have a deficiency in serotonin. This is probably something you were born with. And often people who have depression and anxiety have a family history. So you're sort of born with this imbalance, and then the medication steps in to correct that imbalance. So it's sort of like, oh, this is like insulin for diabetes or eyeglasses for someone who's nearsighted. And so that's often what patients are told. And if you talk to a prescribing physician and ask them if that's actually what's going on, they will probably tell you it's more of a metaphor, that it's not, like, we know in the research now that that's not the case. There's never been confirmation or evidence that that's actually what's going on. That doesn't mean that medication can't help people. So in some people, it's about 30% of people that try medication respond to it. But the effects are pretty minimal. So, you know, overall, if we look at the general population, so there are some people that will tell you that either they or a family member or a close friend was feeling extremely depressed or anxious, tried a medication, and it really made a difference for them. But those people are washed out by an equal number of people who experienced just as much harm from medication in terms of side effects, or others that just didn't notice a response at all. So, you know, we just want to support everybody and make sure that there are comprehensive solutions. So where depression comes from, I mean, so we do have serotonin, sort of our happy hormone. We have dopamine, which is associated with motivation and positive mood states as you're trying to chase a goal. It's associated with sort of this mental sharpness, you know, verbal acuity, sort of like creativity, and just that drive that we'll experience. And norepinephrine, which is a stress chemical, but has a component of euphoria and high energy. And so that can sort of boost our mood. So, you know, in depression, one of the key symptoms is that we feel lethargic and low energy. So these three neurochemicals are really important for mood, but there's so many other things going on. And in the brain of someone who's depressed, one thing that they consistently find is high levels of cortisol, which is a stress hormone. So there's high levels of the stress hormone, but the brain isn't responding to it properly. So this person is experiencing high stress hormone, but low effects of this stress hormone. So they're feeling fatigued, brain fog, low motivation, low drive, especially morning grogginess, disrupted sleep, changes in appetite, changes in weight, all of those classic symptoms. And so we have to understand, like, where would all that be coming from? Because we know that we're not just a brain and a body separated. We have our gut microbiome. We have antioxidants that our cells need to produce to clear out something called oxidative stress, which is sort of like these chemicals that can start to create inflammation in our brains. There are all these processes that go on in our body that are all connected to our mood states. And essentially, like, inflammation is one of the key players in someone with depression. So a little bit of inflammation that exists in the brain and body. And inflammation is, so if you cut yourself and you're, you know, and the area around your cut becomes red, swollen, painful, and hot, those are the 4 signs of inflammation. And that's, you know, an acute process that happens so that your body can heal. Your immune system creates inflammation to heal that wound. You know, you bang your elbow, same thing. You have arthritis, similar thing. But what happens is when we have low levels of inflammation, particularly in the brain, where we don't have pain receptors, what we normally experience is more of a brain fog, low mood, potentially anxiety, difficulty concentrating. So all of these sort of more cognitive symptoms rather than like pain in our brain, like you might feel if you cut yourself or hit your arm or an area of the body that has pain receptors. So we know that inflammation is important for looking at one of the underlying causes of any sort of mental health condition, but depression is one of the more common ones. And so our goal as naturopathic doctors is, I mean, one thing we can do is prescribe anti-inflammatories. So like Advil is one, but more natural versions would be like curcumin, turmeric, or fish oils, some of these common therapies that you might find or read about for depression, like natural therapies. But our goal is to find the source of the inflammation, right? So we're looking at what is driving this fire in the body that's causing these low mood states. And the gut microbiome, because that's where most of our immune system lies, in our gut, is one of the key areas where we might uncover the source of inflammation. So, and there's so many different things we can talk about in that area, but, there are things like leaky gut, where the barrier between the gut and the rest of the body is permeable. So you think of like an open border between countries, sort of like letting a lot of things in and out that maybe shouldn't be there. Let's say, like, your body really wants to keep things controlled in terms of what it lets in and what it keeps out of the body. And and if something is inside our digestive tract, it's still technically outside of our body. It's not because the digestive tract is open to the rest of the world, sort of like a long tube that goes from mouth to anus. And so anything that you consume is not yet quite part of you until you digest it. But with leaky gut, you start to absorb different things that may not be good for you. And then when we have an imbalance in our gut bacteria, that can also drive inflammation. And we also know that gut bacteria can produce some of those neurotransmitters we talked about, like serotonin, dopamine, and even cortisol. So, our body is this whole ecosystem of different things going on, and we're trying to understand it. And if you drop chemicals in a river, that may affect things downstream from that river. It might affect the kind of trees that can grow, the kind of animals that live. So just, altering one part of an ecosystem can have these widespread effects, because everything is connected. And same goes for our body. So an imbalance in the bacteria in your gut, or consuming daily a food that your body doesn't like, possibly could have these effects that drive inflammation and then lead to low mood and depression, or something like anxiety, or even bipolar disorder. And so our goal is to go upstream and figure out what caused it all. Yeah.
Yeah, for sure. And inflammation drives so many different processes, right? Like, and I can speak from personal experience. When I was in the throes of my PCOS, I was super constipated, for example. And once I started changing my diet a little bit, and that is a huge source of like how we might be contributing to our own inflammation on a regular basis, is by the food choices that we make. And that shifted my gut, and that automatically started shifting my hormones as well. And then the mood changes that I was having, because I had low mood, and then that was exacerbated when I went on the birth control pill, and then it was still there when I came off the birth control pill. So there's all these like connections that we sometimes miss, because we're like, okay, anxiety, depression has to do with the brain, let's treat that only and not look at all the other things that might be happening. So can we talk a little bit about the birth control pill and how it can impact mood? Because some women, as you mentioned, even with medications for anxiety or depression, they tolerate it really well and they see an impact from it. Same thing with birth control pills. Some women feel kind of the same. Some women feel maybe a little bit better because their hormones are in a different state. However, there's a huge population that does not do well on them. What impact is the birth control pill having on our neurochemistry and our biochemistry?
Yeah, so again, it's kind of this idea of altering one aspect of our health. And this is a lot of what, again, not anti-medication, but when we prescribe medication, we have to understand the far-reaching effects, because one of the things that medications do are target one specific thing, but our body doesn't work that way. And when we think of adding hormones to our system, so the hormones in the birth control pill are synthetic estrogen and synthetic progestin, it's called, and some combination of those two. So sometimes you can just have a progestin only pill. It's not very common though, or you can do something like a Mirena IUD, which is just local progestin in a physical IUD that's supposed to be just working locally. So every single cell in the body interacts with those two hormones in some way. So when we think of, okay, birth control pill is just going to work on our reproductive system, that's not exactly right, because we do have receptors in our brain, bones, breast tissue, like every tissue is influenced by up the fluctuations of estrogen and progesterone. And we know this, right? Because before your period, you may feel a different mood state. If you're sort of tracking your period and paying attention, as you always talk about, there are these different moods and emotions, and even just the way that our cognition works is different as our hormones fluctuate throughout our cycles. So when you're adding in a synthetic version of those hormones, and you're kind of, first of all, flatlining your hormones, which for women that are going through huge ups and downs might actually be a bonus, beneficial. But you're not actually adding in the exact hormone. So they're a little bit different. It's kind of like trying to, so when you try and open a lock with a different key, it might slightly fit, but it may not turn that lock exactly the way the key that was made for that lock will. And so same thing with these hormonal systems. Hormones act like locks inside a key, which are receptors on our cells. And they talk to those cells and tell them what's going on and what should happen in the body. And so if you don't have a perfect fit, you're not going to get the exact effects of what a natural version of that hormone might do. And sometimes in some women that might not matter, but in others it might, because our estrogen progesterone fluctuations are impacting our brain and our mood, inflammation levels, gut microbiome, like essentially the entire system. And so a woman who maybe doesn't make enough progesterone, which could cause something like anxiety or or more inflammation in the body, or issues with the kind of bacteria in their body, or things like elimination. They may be a little bit more constipated. They might notice more weight gain, more water retention, things like that. Adding in a progestin, a synthetic version of progesterone, may not have the effects that reverse all those symptoms in every single part of their body. It might not alleviate anxiety. And if a woman has normal fluctuating hormones, but is just using the pill for contraception, it might alter her hormones in a way that's not beneficial for her. And we have a large Danish study that was done in, I believe it was 2015, but I can double check that. And it did show a correlation between teenage girls being prescribed oral contraceptives and their risk of depression. And so we know that altering our hormones is going to have an effect on our mood in some way. And so it's really about just, working closely with somebody who's considering that potential side effect and being able to adjust, because there's so many different kinds of contraception, right? And everyone, and we all have preferences and needs according to how our ability to take a pill every day, what our contraceptive needs are, what we feel comfortable with, what our sexual health, goals are, our fertility goals, and, are the other factors, like if we're dealing with something like endometriosis or fibroids or PCOS, like you said, we all have different needs. And so being able to work closely with your prescribing doctor or a complementary physician like a naturopath, who may not necessarily be prescribing that medication, but can kind of coach you on, how that pill might be affecting your mood and hormonal state, is really important. I've had some patients come in and, be on one pill, be experiencing various side effects, and our treatment was just to send them back to their family doctor requesting a different pill that just has a slightly different focus and a slightly different effect on hormones that was just better fit for them. And then those side effects went away. And so a lot of it is just giving things a different try and just being aware of that connection, right? And then there's also, there's some evidence. I mean, there's also some nutrients that might be depleted with the pill that we have to consider. So vitamin B6 is a big one. It's important for making serotonin. And if we're deficient in B6, we might not be making enough of serotonin. So it's also important to just consider, how are we supporting that river that we're slightly altering, right? And can we understand how our whole system might be affected by this thing that we're adding, and can we adjust and make sure that we're supporting that system and minimizing side effects in that way?
For sure. And oftentimes it is those simple strategies, right? Like adding in some B vitamins, like B6 especially, in those women, and their mood completely changes, their energy completely changes, because their body's working at a different level now, even though they're on the same medication. And I wanted to go back to a point that I've forgotten, but I'll come back to it. Yes, I remember now. So it has to do with like the different types of birth control. There's, especially now, there's so many varieties of different combinations that we can get, and dosages that we can get. We know that for PMDD,
Mhm.
there's specific ones that you can use, and if you use them cyclically, so just in the second half of the cycle when those symptoms come up, like that's as effective or more effective than using it throughout the whole cycle, because then the body gets the chance to kind of take a break from it for 2 weeks. So definitely having these, I feel like it's just having these
Mm.
conversations with prescribing doctors, and maybe having another practitioner such as a naturopathic doctor, a functional medicine doctor, who can pick on the other things that are either being missed or not discussed, right? Because we're very accustomed to this healthcare model where if doctor prescribes, we do. And we don't really question a lot of it, which was definitely my experience many years ago. I was put on birth control pill without really much of a discussion. And I also wasn't a good candidate because I have a family history of cardiovascular disease. And personally, I started getting like migraines right off the bat, on the birth control pill. So definitely
Right.
having a lot of these conversations, maybe switching medications or looking at options if it's not for a contraceptive purpose, because oftentimes these medications are also being used as first line options when, someone might not be drinking enough water, or they're not, eating a variety of foods that will shift their gut microbiome to be healthier, or, eating a lot of inflammatory foods like high in sugar and refined foods, and drinking a lot of coffee and drinking a lot of alcohol, which will ultimately have an impact on everything.
Totally. Hmm.
Yeah.
Yeah, that's a
So
good point, right? It's like I always talk about this, like it's not that it's inappropriate to go in the pill. It just, is this a first line treatment for something that maybe we can use another therapy for? And it's all about just being informed. Like, what are your
yeah,
goals? And I've been on the birth control pill before for contraception because it was the best choice for me at the time. But if I had, irregular cycles or heavy cycles, I may choose a different course of treatment first before reaching for that option. And I think patients just need to know what the available options are and exactly how the pills are working. Because one thing that they'll say to me is, I'll ask about periods and menstrual cycles, and patients will tell me, well, yeah, my cycle's really regular, it's light, I'm on the pill. And one of the things that we have to talk about is that your cycle or your period on a pill is not actually a real period, it's a withdrawal bleed. And that's, so we just don't understand the effects necessarily of what the pill is having on our bodies. And it's not it's not necessarily good or bad. It's just about being informed and really understanding what the impact might be, and so that we can make an empowered, informed choice about it.
exactly. And then ultimately it comes back to the patient, whatever it is that they want to do, and supporting them in that choice. But oftentimes it's just not presented as a choice, which is unfortunate. So we talked a little bit about the hormonal changes, and impacts on mood that happen. Can we go through a menstrual cycle and what some of those mood changes, hormonal changes look like?
Sure. Yeah.
I like
So,
talking about cycles a lot.
so cool. Yeah, it's so interesting, because one of the things with hormones is, so we like to think linearly, right? We like to think this does this in the body. It's just a simple way to conceptualize things. But hormones are so sticky and difficult because they're webs and networks. And when you start to dig into what they actually do, they don't necessarily have this linear effect. So if you take something like estrogen has certain symptoms if you have levels that are too high, but also if your levels are too low, there are symptoms. And sometimes the excess estrogen symptoms and estrogen deficiency symptoms can look similar. And then there's also the relative levels of hormones, right? So you might look like you have high levels of estrogen where your estrogen levels are completely normal, and it's that progesterone, which opposes estrogen or works with estrogen to balance it out, may just be too low. And so, like, take testosterone, for example, or male hormones, androgens in a woman's body. If a woman has high androgen-like symptoms, it's like acne, hair loss in places you don't want, which is what you say, and hair growth in places you don't want. Maybe changes in body composition. There's a whole bunch of different effects. But if I test a woman's body, a woman's blood, I might find that their testosterone levels are low or normal, and it's about the other hormones not being able to balance out the testosterone levels. or other androgens like DHEAS or DHT. So it's all about looking at this big picture and trying to understand how everything works together, how it affects our other systems in the body, like cortisol, insulin, blood sugar, gut health. There's a whole bunch of things going on. And estrogen also affects our levels of dopamine, norepinephrine, serotonin. There's a whole bunch of stuff going on. But generally, what happens is the first day of your cycle is the first day that you bleed, the first day of your period. And that's where your hormone levels are essentially like at their lowest. It's the drop of those two hormones that causes the shedding of the uterine lining, so the menstrual cycle. And then what starts to happen is estrogen starts to climb, and it reaches a little bit of a peak around ovulation. It dips a little bit after ovulation, and then it peaks again mid-luteal phase, which is about a week. If you have a 28-day cycle, about 7 days before your period, so in the last 3/4 of your cycle, you'll get another bump up of estrogen, and then it drops. And after ovulation, progesterone rises, peaks around the same time that estrogen peaks in the mid-luteal phase, that same, day 21, 1 week before your period of a 28-day cycle, and then drops. So estrogen's got a little bit like an M pattern. So it rises, it dips a bit, rises again, and drops. And progesterone is just like an upside down U. So rises and falls. There are other hormones at play, but those are our two big ones in terms of promoting ovulation, building a uterine lining. And so, what we typically notice is when estrogen builds, depending on other factors, typically we notice, so estrogen slows down dopamine clearance, and dopamine's all about motivation, focus, positive mood states, drive, particularly sex drive. So when estrogen rises on its own, sometimes, so like that kind of during ovulation, some women will feel really motivated, really focused, able to perform well, more creative. But when estrogen's a little bit too high, we might also feel more anxious. So it depends on how your body, like your maybe genetic predispositions, the presence of other hormones in the body, how you might respond. But typically the first half of the cycle, women feel more positive mood states, more motivation, more energy. And the second half of the cycle, particularly that week before your period, a little bit more of a volatile mood. And this could look like more irritability, more anxiety, more sort of low mood states. And this has to do more with, the balance between estrogen and progesterone during that second half of the cycle. So progesterone typically has like a calming effect on the body, but when those two hormones are out of balance, that can cause more anxiety. And also how we are able to clear estrogen, because when estrogen goes too high, it can also be associated with anxiety. It slows the clearance of epinephrine and norepinephrine, our anxiety hormones. And some people will experience inflammation in response to some of those chemicals, which can then cause low mood. So, typically women will feel the best once their period finishes and the worst right before their period starts.
Yeah.
But we have like tons of variety, right? Because somebody might be suffering from painful periods, and so that week's not going to be fun. Premenstrual migraines, premenstrual dysphoric disorder, or PMS. So something, hormonal states associated with other things like histamine and a sensitivity to progesterone, particularly, that are causing rapid and very dramatic changes in mood when those hormones shift. And so it's really like understanding a woman's experience. And I love tracking cycles and just really paying attention to how you feel, because everyone feels a little bit different. And I know you talk a lot about just working, like being aware of your cycles and then trying to arrange as best you can your schedule or your goals for the month around your best times, and then scheduling in more rest during the times that you most need it, eating more chocolate maybe when you need it, that kind of thing.
I'm actually out of chocolate right now. I used to do a grocery shop errand. So we're recording this during COVID-19 physical distancing. So, the 2-week shopping trips have rendered me without chocolate for the last few days.
Yeah.
But thankfully, it's my follicular phase, so I'm tolerating it pretty good.
Yeah, you're like in a week or so, you're like, I gotta run out.
I gotta have some chocolate.
Yeah.
But it's so true, like what you were talking about, this interplay between hormones, because even when we look at research on estrogen and progesterone alone, the impacts on different cells is so complicated. Even if we look at like fibroids, for example, and they're like the role of estrogen and progesterone, it's not just estrogen and progesterone, it's all the other factors as well, the interplay. There's receptors that are turned on and off by like the same thing. There's so much interplay, and we can't really just be like, okay, this is cause, this is effect. And that's why I love our medicine, because we look at the whole body and figure out what can be contributing factors. Even if there's not a clear-cut answer, we can piece it together really nicely, and support our patients in that way. And the hormonal system, for sure, it's like a web, and then it has offshoots from that web, and then the neurotransmitters, for example, have their own web, and then there's like feeding into the gut. Like each of our systems have their own webs, and these are like complicated layers of intertwined fun. So
Totally.
yeah, so like the body's super fascinating, and that's why I chose medicine in the first place, because I loved how everything was so fascinating, even at the cellular level, how the mitochondria work and how your organs work and all those sorts of things. So it's if you're a listener, just make sure you understand that it's not just like one thing and then one result. It's everything is connected, and everything is interconnected. So when we're talking about treatment plans, that's why we're talking about diet and lifestyle and mindset and supplements and acupuncture and testing. And testing isn't everything, like you said. We have to actually listen to what you're experiencing and then connect everything to that, because brain inflammation for someone can look like one thing, but for another person can look like another thing. Low progesterone can look like one thing for someone, and then look like premenstrual spotting for someone, but it can look like really high anxiety for someone else, or a combination for another person. So we also always have to keep this perspective and this bird's eye view when we're talking about health in general. So we talked a lot about hormones and neurotransmitters and mood and medications. We talked about all of these things. So what are some of your top tips or just top suggestions for people who might be having some mood issues? What's a good place to start? Which is,
it's tough,
loaded
right?
question.
Right. Yeah, so I also want to jump off of what you were just saying, right? So we really want to, we're so tempted to think linearly, but you'll see if you research, like you just said, if you look up what does estrogen do, you're going to see that it causes thickening of the uterine lining, causes the proliferation of breast tissue and secondary sex characteristics in a woman. And then you read about something like estrogen dominance, which is sort of in natural health spaces, and estrogen sounds like this evil thing. And then you look at conventional medical research, and the drop of estrogen is what's causing all the symptoms of menopause, like vaginal dryness and brain fog and decline in cognitive function, motivation. So it's really about looking at that whole system, because you can't just say estrogen does this, and it doesn't act like a drug. Whereas a drug is like has one effect or one goal. And of course, drugs don't cause side effects. They're just part of the effects of the drug. They're just unwanted. But we're trying to chase a specific goal. And it's tough to do that, because our body doesn't, it's hard for us to even think about how hormones work, because we are such linear thinkers. So when we're thinking of, okay, what would we do for somebody with a specific symptom, we're trying to think as non-linearly as possible. We're trying to paint the entire web out as best we can and bring in as many puzzle pieces and factors as we can to start to connect the dots and get this picture. And part of that is the health history. That's extremely important, is going through in detail all of these different factors. And a lot of the time, there's strange questions that someone might be asked. Like, I might dig into someone's response to a medication, which is going to give us clues to what is going on at the level of their biochemistry and hormonal chemistry. What kind of pill was a good fit for you? What kind of pill produced side effects that you can tolerate? Just really understanding what's happening, looking at things like, are you bleeding halfway through your cycle? How does that match with your blood work when we're looking at hormonal levels? So we're like trying to really understand as much as we can, mapping out someone's cycle, really diving in to symptoms and paying attention in a way that you may not have been asked to pay attention before, right? Like a lot of the time people are perplexed, like, okay, I didn't notice that this was connected to my cycle. Let me come back after I track for a bit and let you know. So a lot of it is tracking. A lot of it is gathering a history. Doing some really focused blood work can help. Potentially physical exams is really collecting all the data and then painting a picture of it and synthesizing it to try and understand what could be going on. And then what we're trying to do is, so we work under the assumption as naturopaths that our body is intelligent and is invested in creating health for us. And so we're looking at, what obstacle might be in the way of our body being in its healthiest state. And can we remove that obstacle? Can we strengthen the system responsible for promoting health? So if we're looking at, maybe, your estrogen is too high at certain times in your cycle, and that's one of the areas that are causing these symptoms. We're looking at, okay, why might that be happening? Is your liver not clearing those hormones efficiently? Is your gut microbiome turning the estrogen back on and allowing it to be reabsorbed? Is there a deficiency in certain nutrients in the diet that are helping with estrogen breakdowns? We're trying to pull all of that together and essentially just set the stage for proper hormonal balance. So where I would start, I have kind of a pyramid. I like to communicate with patients sort of what's going on, because if you deliver a treatment plan, it kind of looks like we're making diet recommendations, we're prescribing herbs, we're prescribing vitamins, but it's nice to know what is our therapeutic strategy. What's our therapeutic pyramid? And I always start with baseline health foundation. So, if you have a wilting plant, chances are you're going to think about it in terms of what does this plant need that it's not currently getting, and trying to set general lifestyle principles that are just feeding our body and promoting health that our body needs. Like, we need food and nutrition, we need movement, we need social connection, we need time for rest and relaxation. There are just certain things we need. And we don't need to be perfect at any of these things. We don't need to be on the best diet ever or, running marathons. It's more about how are we balancing our life to provide our body the soil and the conditions for health that are appropriate. And, sometimes though, that just making those adjustments, right, just adding in more salad or just saying go outside in nature for a walk is not enough, because we've been in a state of deficiency or excess for too long. So a good example is somebody who is anemic because maybe they weren't getting enough iron, let's say, as a cause of that anemia. It may not be enough to just add in more iron-rich foods. We might actually have to supplement iron for a while to bring them back up into balance. If someone's been magnesium deficient for a while, prescribing something like magnesium to bring them back into balance. Or if someone's been experiencing extreme stress, removing those sources of stressors as best we can. It may not be enough to just kind of, take a half-hour rest every now and then. Like, we have to remove some of those obstacles to cure. And then, so that would be the second stage after we establish health foundations, is to look at, what are some of the excesses that we can remove? And we can't remove all of them. Like, we can't necessarily just tell you to quit your job. What are some of the excesses that we can remove? And what are some of the deficiencies that we can restore? And, and of course, we're looking at the cause of those deficiencies, but oftentimes it just, maybe we just need higher levels of nutrition because of our own individual needs. And then the third stage I work at is reestablishing the balance between our hormonal systems. And so one of the things that happens with hormones, particularly, or other chemicals in the body, if we have been in a state of deficiency, or if there have been certain excesses going on for a while, is that our body can no longer bring itself back into balance or homeostasis. So we end up in these vicious cycles. And so we can take estrogen excess as an example, where if you're not eliminating estrogen properly, some of the estrogen actually can impair that same process of elimination. So you get stuck in a vicious cycle where the estrogen, the issue is causing more of the same issue. And so then we have to, I believe, as naturopathic doctors, intervene in that cycle and try and reverse it or stop it. So in that case would be like working on the gut microbiome to get things moving, putting, adding in some phytoestrogens into the diet to help with rebalancing estrogen, working on liver clearance, adding in nutrients. And at that stage, I like to work with herbs a lot, because herbs work very much like hormones, where they rebalance things in a very intelligent way that acts like a network. Because herbs are like they have certain chemicals that work like hormones, and they tend to have a very balancing effect on the body when it comes to hormonal systems. So I often use herbs at that. Take magnesium, and here's Vitex, so it could be like that. But it's all about the strategy and stacking and figuring out, what are the best recommendations for that person and communicating that to them.
Yeah, and you framed that so nicely, like, getting rid of the obstacles, or as much as possible getting rid of the obstacles, and then addressing the nutrient deficiencies or excesses, and then maybe pressing restart or reset on some of the organ systems that need that support. Because you're right, like there's so many cycles that we can enter. And same thing goes with like gut microbiome and anxiety, right? Like if you're anxious, it'll change your gut microbiome, and then the gut microbiome being different will feed into the anxiety. So we have to, at some point, for depending on the person, press reset on that and kind of reestablish, like, okay, ground zero, and let's go from there. And that's the same thing for like most, especially like chronic conditions or conditions that have been going on for a long time, or anything that you might have recurrent episodes of. It's a similar strategy, right? Like we have to look at everything and then work on it depending on who that person is, what their genetics are, what their symptoms are like.
No, your sound went off. I think you muted.
Can you hear me now?
Yeah, now I can hear you.
Okay. Yeah. So, and it goes back to like what you were saying, and what I love saying is track your symptoms, track how you're feeling, and that could be, in relation to to your cycle if you are a cycling woman, and that could be not related to your cycle if you're like postmenopausal, or you don't have a cycle anymore, or if you're postpartum. Track your cycles, because then you get a better idea of what's happening in your body, and then you can also relay it to your healthcare providers and advocate better for strategies that work for you. That's really why I love tracking, right? Like it just is more information, and more we can make a better and
Oh, you're mute again. No. What's happening?
Let's see.
Yeah, now you're back.
Okay. Technical difficulties.
But yeah, so exactly. Yeah, it's like, yeah, I mean, the tracking is so important because so much information is pulled out of that, right? Like, because we're able to then map your cycle, because symptoms, I mean, most doctors will tell you 80% of the information comes from symptoms, or more even. And so someone can tell you, 3 days before my cycle is when I get a raging migraine, then I start feeling bloated, I get breast tenderness, then I have a very heavy period, then the period stops and it starts again, then I feel amazed, then my mood is amazing afterwards, then I start to get anxious again. Oh, okay, so we're really understanding. I also have constipation, I also get headaches, and have depression. So like we can map all that together and figure out what could be going on and come up with a strategy, as opposed to Googling PMS vitamins and finding a list of like 40 things that you could be taking and not knowing how to triage the importance of any of those things.
For sure. And, I know I've seen lots of those patients. I'm sure you've seen lots of those patients. And then those things, like sometimes it's a great, they picked the right thing that worked for them. But more often than not, it's like, oh, I tried this thing, but it didn't work. Or I've tried supplements and they don't work. But it's not as simple as just saying I've tried a supplement, right? Like there's so much more to it, as you went over today.
Totally. Yeah.
So
And it's
Talia,
hard to be, sorry, just one last
no,
thing.
no, yeah,
But I
please.
mean, and even like with someone with a healthy lifestyle, right? Like we talked about, so those health foundations are extremely important, but when you've been dealing with something for a long time, it just might not be sufficient. So it can be really frustrating when patients come in, they're eating really well, they're moving every day, they're managing their stress, they're doing yoga, meditation, like they've got a whole, health strategy going that's really positive, but they still might be dealing with something. And so it's again, a lot of it's not your fault, and it's just understanding like what might we be locked in these vicious cycles, and how can we intervene with them, right? Or how might our own individual needs not be met, where we might just need more B12 because your body maybe just based on the conditions of your lifestyle, you need more to meet your health goals and meet your dreams, or maybe your body just clears it more efficiently, and so you just need to add more into your body. So just different things like that.
Yeah, and even with like a healthy diet, like going back to what you were saying, that if someone might be eating like really well, eating really well can look like different things for different people, right? Like because we do have different needs based on our lifestyle, based on our genetics, based on who we like, our physiology and our biochemistry and all of those things, and also what stage we're at in life, right? Like someone postpartum might need a completely different plan than someone before that. Or if we look at menopausal women, they're like, well, I've been eating the same, but my body is like putting on weight like no tomorrow. So there's all those variations that happen. And especially if we look at nutrition research, so much of it has been done in men, and then we're translating that to women, and it doesn't work the same way. Women are women, like they're not small men. So we also have to like take all of those things into consideration, because I don't know about you, but I get a lot of women who are coming in on, especially in the last 2 years, on the keto diet, and they're like, yeah, it worked for a little bit, and then I don't know what happened, but like everything stopped working. And that's because women's physiology is completely different. And yes, there was some weight loss because A, it was a shift, and B, keto diets are generally calorically low and more satiating. However, over time, your body needs those other nutrients that were neglected in that diet. So there's so many different considerations to have.
Yeah, totally. And it's like it definitely is no one size fits all for diet. And I think you and another one of our colleagues both had good results with your PCOS, so same condition. And for you, it was moving to a plant-based diet, and for her, it was going from vegetarian to eating meat again. And so you look at that and you're like, well, what's the perfect diet for PCOS? There is none. It's about your own body and what its needs are. And you have different physiology and different needs. And so it's worth exploring different things and working with someone that can help you pinpoint, how the effects of things that you're eating might be impacting your health, and help you realize and make those connections.
Yeah, absolutely. So Talia, I have one question for you, which is, like I mentioned before, we're doing this interview during COVID-19. How are you taking care of yourself? How are you taking care of your mood? Because there's been lots of different moods that we've been experiencing, right? From anxiety to despair and depression to happy and joyful and grateful and everything in between. What are you doing for yourself, and how are you taking care of yourself?
Yeah, I think my biggest challenge has been to get back into routines, and I think a lot of us have been actually moving through the stages of grief, and I didn't recognize it as such, and so one of the last stages is acceptance, and just how does this new way of living require me to change my routines in a different way. And as social people, as social beings, it can be difficult to shift from those like more superficial interactions that actually feed us, right? Like the conversation with someone at the coffee shop, the conversation with someone in your office, the fact that our work is on a routine, and so we would all take lunch at the same time, to then trying to establish more specific routines for the current circumstances. So that's been a big one for me, is waking up at a certain time, having mealtime scheduled, having goals for the day. But the biggest thing for me has been getting outside and being in nature. And there are different thoughts around that. Everyone has a different comfort level when it comes to the potential risk exposure. But I think and we also just don't know a lot when it comes to it's a new virus, right? So we're still gathering data when it comes to like what behaviors may expose you to a risk of infection or transition. But I think as long as you can maintain your 6-foot distance and come home, wash your hands, take all the precautions necessary, wear masks, that being outside is so essential to our health and well-being. And so no matter the weather, I'm getting outside. I also have a dog, so it makes it a lot easier. And I also feel comfortable. I mean, sometimes it's easier to meet the needs of someone that we're caring for than our own needs. So having a pet can be really helpful for like, well, he's got to go out, and it just kind of keeps you on that rhythm. But being outside in nature has been one of the main things that's kept me going during this time. And it's one of the things I'm encouraging people to do. And the other thing is Zoom interactions or WhatsApp or like face-to-face video conferencing with people, setting up dates with people online. So whether we're drinking wine together, having a coffee in the morning together, or even eating our dinner together, you know, the way that I might go and visit someone in their house, I'm trying to schedule Zoom face-to-faces, because you know, we don't necessarily need to social distance. It's about physical distancing. And so the more we can connect, you know, keep those connections alive, the better. And so I'm running a 5-day meditation challenge. I have 2 challenges going. A cortisol cure challenge, which is about regulating our hormonal systems with regards to stress. So using lifestyle to help our stress response, get better sleep, feel more energy. That's a 5-day challenge with 5 days worth of videos, short videos to just explain the different tasks. And then a 5-day meditation challenge based on the request of my online community. And so that is 5 specific meditations, helping people, no matter what your level is, whether you have a meditation practice already or you're just getting started, or just shift you into a daily practice. They're about 15 to 20 minutes. You know, and with lots of coaching around, you know, shifting positions. So it's not something that you need to be advanced to try at all. And with that meditation challenge, I have a little bonus challenges built in, just small self-care strategies that people can implement if they want to. Things like, let's do a media detox today, like as best you can. Maybe it's not appropriate for you to totally shut everything off, but can you just maybe not look at the news most of the day, or maybe just reserve your news exposure to 1 hour today, or things like that that can just shift our mental health and mood, and make us aware of you know, how these new circumstances are affecting our mood and mental health.
Yeah, those sound like great challenges. Your cortisol challenge I did, which was awesome. I highly recommend it, and I'll throw the links to those in the description for this video. And where else can people find you if they want to connect with you or hang out with you?
So you can find me on Instagram, Dr. Talia ND, and I have a Facebook community called the Good Mood Project, and we can put links up for that, where you can access different videos, different resources, and things like that.
Absolutely, and I'm part of that group, and I love it. Talia, as you can tell from this interview, is full of wisdom, and I love talking to her. She's also a good friend of mine.
Yeah, and I have a video with Anne on my page. Yeah.
That's true.
And Instagram. Yeah.
All right, so I'll throw the links to those. Talia, thanks so much for being here. Thank you for sharing all your wisdom and how you approach healthcare and all that information on mood and the intricacies of the hormones. So happy we were able to do this.
Yeah, thanks, Anne. This is a lot of fun.